your stem.
Okay, ma'am.
All right. So if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Okay, considering the scenario, I will
Yes.
manage the patient according to the care of critically ill patient management protocol. At first, I will go through rapid through the
According to
airway
the
breathing.
ABC protocol, yes.
Yes, I'll check the airway breathing and circulation rapidly to the patient. The
Okay.
patient having the severe hypothermia, I observe, and having the metabolic acidosis and raised potassium level of the patient. I will start the external warming the patient by blanket, as well as I start the warm IV fluid of the patient, and as well as
Okay.
I take the blood for grouping, cross matching, electrolytes, and the liver function test, renal function test of the patient.
Okay.
And I also must give the patient peritoneal levels, mediastinal levels of the patient, and I'll also consider the having the metabolic acidosis, so I can give the IV sodium bicarbonate of the patient, and I also control the high potassium level by giving the injection infusion calcium gluconate,
Okay.
infusion glucose, and the insulin, calcium resonium,
Yes. Thank
and I
you.
also considered the hemodialysis of the patient.
Okay. Thank you. Yes, you said you'll consider or and manage the patient according to considering the hypothermia. What is
Yes,
the normal core temperature of the body?
37 degrees centigrade.
Should be less than. When would you call it or consider it hypothermia?
Yes, it's mild hypothermia, it's less than 35 degrees centigrade, moderate less than 32 degrees centigrade, and severe less than 28 degrees centigrade.
Okay. How do you measure core body temperature?
Yes, I can measure the core by body temperature orally, axilla, tympanic membrane, esophageal, also the rectal.
Yes. Okay. In this case, patient, we could see apparent cause of hypothermia, but normally, what are the causes of hypothermia in a patient?
Okay, ma'am. The causes of hypothermia includes the severe blood loss,
Yes.
massive blood transfusion,
Yes.
uh, expose or surgery, combined
Prolonged.
use of the
Exposed
general,
to prolonged surgery.
yes, expose
Yes.
prolonged surgery, combined use of the general and regional anesthesia. If the
Okay.
patient doing surgery less than 36 degrees centigrade temperature.
Yes. And hypovolemic shock.
Yes, I have only sure.
And yes. All right. Okay. Just suppose all the measures that you're doing, you fail and you do not get to manage the patient on time. So, what are the complications that can result because of patient's hypothermia?
Yes, lots of complication patient occurs in the cardiac system. Patient having the decreased cardiac output, cardiac arrhythmia, ventricular fibrillation. In respiratory system, increase pulmonary ventricular ratio, decrease ventilatory effort of the patient. In case of GIT, decrease metabolic gut motility. In
Yes.
case of the metabolic system, patient who will be hyperglycemic, resistant to the insulin,
Good.
decrease basal metabolic rate. In case of hematological, decrease platelet function, decrease coagulation, increase the
Okay, thank you.
increase
You know it.
hematocrit.
Yes, please tell
And
me, yes,
okay,
please tell me how a person can reduce the risk of hypothermia according to the NICE guidelines.
sorry, ma'am, please repeat.
According to the NICE guidelines,
Yes,
how can you reduce the risk of hypothermia?
yes, ma'am, yes. According to the NICE guideline, I avoid I avoid prolonged fasting, avoid prolonged exposure to surgery, um, keep the body operating room temperature 21 degrees centigrade.
Yes.
Don't intubate the patient less than 36 degrees centigrade. Expose the patient as little as possible. Use the warm IV fluid, IV irrigation, and not transfer the patient temperature below the 36 degrees centigrade.
Okay, please tell me what is the mechanism behind this hypothermia? How this temperature can be managed?
Temperature we can manage by using the external warmer
No,
like blanket.
mechanisms in the human body. We have certain mechanisms by which we can manage or control the body temperature.
Yes, by shivering.
Okay, this is one. But this
Shivering.
hypothermia mechanism occurs by what is conduction and
Yes, conduction, convection, evaporation, and radiation.
what are these?
Conduction.
Yes.
Yes, ma'am, I can say. Conduction is the direct heat transfer to the operating table and
Okay.
using the cold IV fluid. This is conduction. Convection
Yes.
is the by warming the cool air around the patient. Evacuation is the open abdominal wound. Radiation by the radiation to the cool bodies in the operating theater by vasodilation.
Okay. Why does it say with radiation 50% of body temperature can be managed? Why the figure of 50% has come in it?
I can't say, ma'am.
Okay. Right. Okay.
Ma'am, it's maybe
Yes.
the cutaneous vasodilation.
Yes. And you know it. You just have to think. Okay. What are the physiological? Now you have to tell me the physiological complications of hypothermia.
Yes, it's the hypocalcemia,
Yes.
metabolic acidosis,
Very good.
increase oxygen affinity to the hemoglobin that leading to hypoxia and decrease tissue oxygenation, and then negative nitrogen balance, impaired immunity of the patient, dysfunction of the platelet, dysfunction of the enzyme, and cardiac arrhythmia.
Good. How would you take care of the metabolic acidosis of the patient? The base
Okay, ma'am.
deficit, yes.
Patient having the metabolic acidosis, so I'll give the injection sodium as well as I'll manage the hyperkalemia of the patient.
All right. Good. Okay, just suppose you've tried all your measures, you've tried everything possible, but you failed to manage the hypothermia of the patient. What is the last resort that you can do? What is the last
Yes,
thing?
I can do the extracorporeal
Very
cardiopulmonary
good.
bypass.
Excellent. Yes, that can also be done. Very good. Excellent. Thank you.
Thank you, ma'am.